بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. Sisters and brothers, Salamullahi alaykum wa rahmatuhu wa barakatuhu. It's a great pleasure to be with you in this program discussing family welfare, discussing a good family lifestyle. My contribution will be regarding the psychological well-being of the family. I will concentrate on that angle. Now, family health and child health, they are like an egg and a hen argument. When you've got a good, healthy family, you get healthy children. Now, if the children are not healthy, they will grow up to be unhealthy adults who will be running unhealthy, dysfunctional families. So, each one of these two gives rise to the other. Now, good mental and physical health requires that children grow in a healthy family so that they can be successful adults who will have successful families. Actually, there is no other way of bringing up children except the family. People may think of many models, but nothing can replace the family. Because the family teaches the attributes or sifat needed for a balanced psychological health. Children learn trust, loyalty, a sense of belonging. They learn their rights and responsibilities from the family. There's no other institution that can carry out this job. And the family is the basic social unit of our society. It's both an economic and healthcare unit. Now, when the family is dysfunctional or is inefficient, it will lead to several dysfunctional families 2 to 3 decades later, because the children from those families will be dysfunctional and cannot set up healthy, harmonious families. So the vicious circle continues. We need to break that vicious circle. Now, again, when we talk about family health, we have got another hen and egg argument. Family health and community health. Good family health will lead to good community health. Bad community health will lead to bad family health. The two are interacted. We didn't talk about communities until recently in the Western scholarship, but in the Quran, the concept community has always been emphasized. And the Quran has told us about communities that came before us as lessons so that we don't repeat their mistakes, or so that we can follow the good things that they did. Quran talked about al-balad al-tayyib. والبلد الطيب يخرج نباته بإذن ربي والذي خبث لا يخرج إلا نكدا كذلك نصرف الآيات لقوم يشكرون. Allah talks about the good society and also talks about the safe society, البلد الأمين وهذا البلد الأمين. The Quran also talks about many societies that collapsed before, communities that collapsed before, or were destroyed by Allah subhanahu wa ta'ala because of their moral deviations, their dhulm or transgression, and corruption. But what we know is Allah does not destroy a community until it has got warning from Allah about its behavior. As Quran says, وَمَا كُنَّا مُعَذِّبِينَ حَتَّى نَبْعَثَ رَسُولًا. We are not going to punish until we send a messenger. So, a healthy community is the basis for a healthy family. And we can learn a lot from the Quran, from models of good communities and models of bad communities that the Quran talked about. Now, let us go back to psychological well-being. I am making the proposition is that psychological well-being is the basis for a good family health and a good family lifestyle. Unfortunately, we have got a lot of unrecognized mental ill health in the community. Many people have got mental problems. These break families, but not recognize this mental health or these mental problems. Many of the people we think are bad husbands or are bad wives actually mentally. So what you see them doing in terms of abuse of the family, violence, neglect of the family, are just symptoms of that underlying mental illness. They are not necessarily bad people. They are sick people who need treatment. Therefore, early diagnosis and treatment of mental disorders would prevent family dysfunction and breakdown. And what happens is that some of the problems, mental problems that break families can be treated simply using simple medications, simple tablets or psychotherapy, and then we can save the family. In the older days, we had grandparents who actually were the psychologists. They used to recognize these problems. They used to counsel families, give advice, and solve these problems. Today, we don't have those people around because our society has become sophisticated. We're working all the time. We are busy with many other things. And the role of those marriage counselors who used to know psychological problems and deal with them is no longer there. So actually, we need marriage counselors today as professionals with psychological training. And I think that undiagnosed psychiatric illness is the underlying cause of many social problems. Marital discourse, nuisance, violence, homicide, incompetence, and neglect of self and others. I will be talking more about the common mental issues that we face. And then towards the end, I will talk about how we can deal with them in order to save our families. So these mental issues can be neuroses, which psychosis that are more severe, or personality disorders that are also more severe. In the modern society, these mental issues are complicated by new things, new addictions, like addiction to drugs, addiction to alcohol, and then the perverse lifestyles that are common in modern societies. What I want to emphasize is that we need to develop a general understanding and awareness in the community that family problems may be due to mental health, and try to solve those mental health problems so that the family does not collapse. Just recognition of mental health as a possible cause of family problem is already half of the solution, because then we can take measures to save the family from collapsing. Now, let us talk about the different types of mental health problems. I'm going to mention them, but I want you to realize that what I'm going to say is very common. Even apparently healthy people have some of these issues. The people whom we call mad are those who have got extremes of these problems. But these problems occur in normal people, and we need to recognize them. Neuroses are simple mental disorders like anxiety, phobia, hysteria, obsession, or depression. These actually should be treated to start with by dua to Allah subhanahu wa ta'ala, acts of ibadah, and finally psychotherapy if necessary. The Quran has talked about many neuroses. I talked about sadness, about worry and anxiety. For example, sadness, huzn, was mentioned in general and also in the specific case of sadness due to separation. Allah talks about, says, وَلَا تَهِنُوا وَلَا تَحْزَنُوا وَأَنْتُمُ الْعَلَوْنَ إِن كُنتُم مُؤْمِنِينَ. Allah says that do not feel sad. Don't feel sad. وَلَا تَهِنُوا وَلَا تَحْزَنُوا وَأَنْتُمُ الْعَلَوْنَ إِن كُنتُم مُؤْمِنِينَ. Then in Surah Yusuf, Sayyidina, the father of Yusuf, was saying, إِنِّي لَيَحْزُنُنِي أَن تَذَهَبُوا بِهِ وَأَخَافُ أَن يَأْكُلَهُ الذِّئْبُ وَأَنْتُمْ عَنْهُ غَافِلُونَ. I am afraid that I will be sad. You will take Yusuf with you, and the foxes may eat him, and when you are not paying attention. So the father was feeling the sadness of separation. Also, the Quran talked about worry and anxiety. The Quranic terminology for this is al-ham wal-gham. ثم أنزل عليكم من بعد الغم أمنا. So, Quran talks about these neurotic manifestations. They are normal in humans, and we need to be aware of that. Psychoses, on the other hand, are more serious disorders. They include schizophrenia. Schizophrenia actually is very common all over the world. About 7 out of 1,000 in all societies have got schizophrenia. It's, of course, has got different degrees. Now, the Quran uses the word madness, junoon, to refer to major disorders like psychosis. Now, psychosis can be organic. You may have epilepsy, for example, causing a psychotic illness, or they may be functional, such as manic depressive disorder. These are disorders in which you feel very high, very happy, and then suddenly you feel very unhappy in depression. There is depression that's endogenous, that is always there, has no cause. There may be depression due to a situation called reactive depression and schizophrenia. Now, schizophrenia, which I said is a very common condition and causes a lot of problems in families, husbands and wives, it involves disorders of thinking, confused thinking, confused emotions. Somebody will be happy when they should be sad. It also can have body movements like catatonia, delusions and hallucinations. So it's a common condition, and diagnosing it and knowing it will help solve many of what become quarrels and misunderstandings in the family. Because instead of thinking that a husband or wife is bad, now you know that the husband or wife is sick and requires help. I will talk in more detail now about many of the manifestations of mental disorders. And many of you will realize that you see them in societies, in families every day. Delusions, that's when somebody is confused. Something is not real, okay, but it seems real to him, and it's not even logical. It's a delusion. Hallucination is a sensation about something that does not exist. Someone is seeing somebody when he did not see him. A wife may be very mad that she saw her husband walking with another woman. It didn't happen. It may be hallucination. Paranoid, when people are afraid without justification that people are plotting to harm them. Somebody is trying to poison you. Someone is making sihr for you. Someone is trying to kill you when it's not true. It's a paranoid. Affective disorders, these are emotional disorders, such as the bipolar disorder, okay, depression. And major depression is a serious issue because it could even lead to suicide. Melancholia is a severe form of depression when we cannot sleep early in the morning, and depression severest in the morning, no appetite, constipation, loss of interest in love and sex. So the husband may think that the wife no longer loves him. No, she loves him, but she has got an illness. Anxiety, that is a fear that has no basis in reality. Or it may be an exaggerated fear or response to a real threat. It's a small threat, but then you fear it more than necessary. Anxiety. So these issues are always happening around us. Obsessions are recurring thoughts. Your mind is fixated on something and you cannot suppress that feeling. Compulsions is when you make movements that you cannot stop voluntarily. Like somebody keep on kicking, okay? Winking. It's a compulsion. They have no control over it. Hysteria is when you have got a physical symptom, like somebody's arm being paralyzed, when really it is not paralyzed, but it's a psychological manifestation. I've already talked about schizophrenia, which is quite common, and it's terrible because there is a disorder of thought, there's a disorder of emotions, and people go downhill with time. There are also personalities that are considered personality disorders. I talked about the paranoid, always being afraid of nothing. Compulsive, historical. There's a narcissist. I want to talk more about this. A narcissist is somebody who starts by being very nice. They do good things for you. In fact, they make you dependent on them because they keep on doing things for you, bringing you nearer. Once you are near enough and you are dependent on them, then they turn on you and they punish you and harm you. This is narcissism. It's a common thing. Then there is the passive-aggressive behavior. They are antisocial behaviors. The new things that are happening in our society. Homosexuality is a mental illness. Transsexualism, these are mental illnesses. Don't believe people who tell you it's about human rights and expression of sexuality. These are mental illnesses and they have to be treated. Stress is very common. A lot of times we fail to cope with the difficulties and situations and we get into stress. But alhamdulillah, we can control stress internally by salah, dhikr and i'tikaf, in addition to removing what is causing the stress. So as you can see, these disorders do happen in me, in you, and in many other people. But in normal functioning people, they don't occur all the time. They occur in mild degrees. In people who are obviously mentally disturbed, they occur in the extremes. But they will cause trouble even in a mild form, because if the husband does not recognize that the behavior of the wife is a manifestation of a mental problem, he will get angry. He may even divorce. Disease is like any other organic disease. And actually, most of them have got an organic basis. Most of these have got a problem in the brain, either the structure or the chemicals or imbalances in the brain. We should avoid stigmatization. We shouldn't just classify people as crazy or as mad. We should realize that these are problems that require solution. The best solution is dua to Allah subhanahu wa ta'ala and acts of ibadah. These are the first lines of treatment. Then we can use psychotherapy. There are methods of psychological treatment that can solve the problems by discussing with the victim and make them understand their situation. Then they will be able to overcome the problem. There are behavioral approaches also. You can use behavioral approaches and conditioning to deal with the problems. As a last resort, we can use drugs and even surgery to deal with these mental problems. But the point is, we should never let the mental problems continue, because they do destroy our families if we do not treat them. Now, let us consider these mental disorders in marriage. I think mental health should be considered as one of the criteria in marriage. I don't want to say don't marry people with mental disorders, because then you will not get married, because these disorders are around in many people. So they shouldn't prevent marriage, but they should be considered, and it's important that they be disclosed. Because if you marry somebody and you know that they have got a problem, then you know how to deal with that problem. You know how to handle that problem. So disclosure is very important. And disclosure shouldn't be a reason for refusing to go ahead to marry, because these are diseases like any other disease. You may refuse to marry someone because of a simple mental problem, but 1 month into the marriage, there is cancer. So this is a disease and that's a disease. And it's all from Allah subhanahu wa ta'ala. So if mental illness appears after we are married, we should be kind. Like any other disease, I tell you, if your wife gets cancer, if the husband gets a heart attack, you do not divorce them. Why do you divorce them when you discover a mental problem in them? We should be kind and stay together. As Quran tells us, وَعَاشِرُهُنَّ بِالْمَعْرُوفِ فَإِنْ كَرِهْتُمُوهُنَّ فَعَسَىٰ أَن تَكْرَهُوا شَيْئًا وَيَجْعَلُ اللَّهُ فِيهِ خَيْرًا كَثِيرًا. You should deal with them very well, because if you hate something in your spouse, Allah may bring a lot of good out of what you hate. So we should be patient always when there is a mental condition. Now, and we should always be aware that these mental disorders are an underlying cause of family dysfunction. So diagnosing them and treating them quickly will save the family. I'm very sorry that there are many families that have been broken for simple, treatable conditions with 1 tablet a day for a few months. And I would like to appeal to the qadis and the parents that they should not allow divorce before ruling out treatable mental disease. If your son comes to you and says, my wife is this, this, and this, I want to divorce, first of all, stop and check. Could it be a mental problem? If the wife wants to leave her husband because of bad behavior, before you allow the marriage to break up, check, is it a treatable mental disease? Because if it's treated, inshallah, then the marriage can continue. And in any case, any divorce pronouncement or request for divorce from a person with a mental disorder has no legal effect. As Ibn Qudama said, Man la yasihu talaquhu, la yasihu dhuharuhu. He talked about that people whose talaq pronouncements are not considered, and among them are وَالزَّائِلِ الْأَقْلِ بِجُنُونٍ, and one who has lost his brain or mind because of madness. So when somebody pronounces talaq, it does not have a legal effect as long as we suspect that there could be an underlying mental illness, so that we save the family. Children also have got mental disorders. There's a range of them. Some are specific for children, but others are like those found in adults. Many childhood mental disorders are developmental. They have to do with problems in their development. And some start from intrauterine effects or after birth effects. And other childhood mental disorders are because of the dysfunctional family in which they live. And the problem is, if children grow in a dysfunctional family, they get mental disorders, and these have got a long-lasting effect into their adulthood. When they also make families, they are likely to repeat the same behaviors. The social environment also may enhance or contribute to childhood disorders because of negative influences. As the Prophet said, كل مولود يولد على الفطرة فأبوانه أو ينصرانه أو يمجسانه يهودانه أو ينصرانه أو يمجسانه. That everybody is born pure on the fitra, but it's the parents or the family or the environment that can make him a Jew, a Christian, or a Magian. So the environment is very, very important. If the environment is negative, our children will grow with mental disorders. So we should always make sure that we discover childhood disorders early and start treatment very early. Finally, as I said, the family health is closely related to community health. So we need to teach community health in a different way. We need to teach about gender. What does gender mean? Why do we have two genders? We need to teach about the family as a natural social unit. Marriage is the start of family formation, and it has got long-term impacts. Relatives and parents, we need to teach their role in supporting the family, and then the children who are the next generation. So these are the components of the family institution. If all of them are understood well and applied according to the Sunnah and guidance of the Quran, inshallah, we'll have healthy communities. Also, there are institutions in the community that are necessary to play their role for a healthy community. The masjid must play its role. Ukhuwa, the brotherhood, takaful, social, mutual help. Shura, we need to learn to consult one another. And then we need an economic system. Again, these are community institutions. If they're handled well, the community will be healthy. Communities have got problems, so we need also to see how to deal with them. Problems of lifestyle, sexual perversions, addictions are very common. It is a real problem. Many communities fail. Many families fail because of poverty. We need to eradicate poverty from our societies. Violence is a cause of a lot of community problems and family problems. So once we have got a healthy community, inshallah, we can have a healthy family. And we need to remember that mental health is very, very important for a good family lifestyle and should be considered in all issues dealing with the family, inshallah, if we want to succeed. Thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh.